having worked in healthcare for 30 years, the first half of my career being predominantly in acute care hospitals, I really came to a realisation that healthcare needed to start before the patient got to the hospital, and we needed to intervene earlier. And so that sort of set me on a pathway of going, well, where do I want to go and how do I want to be able to deliver healthcare effectively, which led me to naturopathy, became a naturopathic practitioner, and went into clinical practice, basically working to hopefully intervene in people's lives before they get to that critically ill stage. In particular, I have an interest in cardiometabolic wellness, so working with people with heart disease or prevention. I also quite enjoy working with stress-related disorders, so people who are having their depression, their anxiety, or just generalised stress disorders. And immune stuff really excites me as well. I love working with people who have immune disorders, and in particular working with people living with HIV to make sure that they have a strong, robust physical and immune system so that they can live healthy lives. The types of cases I like taking on are the ones which are really complex. So it's when you have a whole mix of things that come together. So that's why I particularly love the cardiometabolic conditions, because we've got the hypertension, we've got the cholesterol that's elevated, we've got the insulin resistance and the diabetes that are developing, and all of that then starts to affect the person systemically, so hunting that out. So those complex cases where there's lots of things that are in the mix, we've got to start to really do the detective work and tease that apart, bring the pieces of the puzzle together to slow down progression or hopefully reverse the effects of what's going on in that person's system. Those are the cases I really love. The same with the stress cases, understanding that gut-brain connection and why those things are so intricately linked together, and working with patients to sort of say, this thing going on inside your gut is also affecting your brain. So we have to work on the physical as well as the mental well-being. I find that fascinating. One thing that constantly surprises me, that surprises the patient so often, is the importance of water. And everybody, cognitively knows that water is an important part. But it's when you stop and explain to them about how important maintaining hydration is, and that chronic unintentional dehydration that occurs over months, years with some people, is a major driver towards the effects that are effects on their well-being. So particularly when I work with hypertension or high blood pressure people, and then I ask them about water, and they might have a glass of water a day, and by simply correcting that hydration, they're often, oh my God, I can't believe it. Something as simple as that has already had such a major effect on my blood pressure. The detective work, that I find the most fascinating, to really start to see the link and not to consider any condition that's affecting a person in isolation. So somebody comes in and they've got a food sensitivity, and not just going, well, that food sensitivity is to do with your digestion and gut, but understanding how that then relates to the whole terrain of the body, the hormones and the mind and the nervous system, all of these things, the inflammatory cascade that can occur, and doing that detective work to bring all those pieces together is really fascinating. And then being able to work directly with the patients and explain to them how that's all related to the same thing, and they become educated, and they then become empowered to correct those things in their own life. It's probably the most fascinating part of the whole functional medicine approach. To expect that I'm fairly tenacious in doing the detective work. So for me, the more information I have to work with, the easier it becomes for me to put all the pieces of the puzzle together and to work with them and to help them understand why their health is where it is at that point in time. So I'm pretty tenacious. I like to ask the questions. I like to gather the information and bring all of that together and then sit and go through that with the patient. The one thing I would change about healthcare is that we would move the focus to more about preventative medicine and health optimization, so that we're really dealing with health care and not dealing with disease management. I think so. That would be one thing that I would really love to see happen, globally in healthcare, is that we shift that focus. We put the money and the resources into the prevention and health optimization, and take the focus perhaps a little off the disease management, although that's still important.